आज की इस वीडियो में ब्लड प्लाज्मा के बारे में मैं आपको बताऊंगा। When the formed elements are removed from blood, a straw-colored liquid called blood plasma is left. 91.5% water and 8.5% solutes. ये जो ब्लड प्लाज्मा होता है इसमें 91.5% पानी होता है और 8.5% सल्यूट होता है और सल्यूट के अंदर 7% जो है वो प्रोटीन्स होती हैं। Some of the proteins in blood plasma are also found elsewhere in the body, but those confined to blood are called plasma proteins. Maintain the blood osmotic pressure, important in capillary exchange. Most of them are synthesized by hepatocytes, albumins, globulins. Albumins, smallest and most numerous, functions as important as transport proteins from steroid hormones and for FAs. Globulins produced by liver and plasma cells developed from B lymphocytes. Antibodies help attack viruses and bacteria. Foreign substances such as bacteria and viruses stimulate production of millions of different antibodies. An antibody binds especially to the antigens that stimulated its production and thus disable the invading antigen. Alpha and beta globulins transport iron, lipids, and fat-soluble vitamins. Fibrinogen, especially role in other solutes include electrolytes, nutrients, regulatory substances such as enzymes and hormones, gases and waste products such as urea, uric acid, creatinine, ammonia, and bilirubin. Formed elements, three principal components: RBC, red blood cells, WBC, white blood cell, platelets. RBC and WBC are whole cells, platelets are cell fragments. RBC and platelets purules. WBC number of specialized functions. Percent of total blood volume occupied by red blood cells is called the hematocyte. Normal range of hematocyte for adult females is 38 to 46%, for adult males 40 to 54%. Hematocyte of 40 means 40% of blood is composed of red blood cells. Testosterone in males stimulates the synthesis of the erythropoietin, stimulates. Lower values in women can be related to the excessive loss of blood during menstruation. Significant drop in hematocyte indicates anemia, lower than normal number of red blood cells. Polycythemia. Percentage of red blood cells is abnormally high, greater than 65%. Raises viscosity of blood, increases resistance to flow, and makes the blood more difficult for heart to pump. Contributes to high blood pressure and increased risk of stroke. Causes of abnormal increase in RBC production: tissue hypoxia, dehydration, and blood doping, or use of EPO by athletes. Formation of blood cells. Some lymphocytes have years of lifetime. Most formed elements of the blood last only hours, days, or weeks and must be replaced continually. Negative feedback system regulate the total number of red blood cells and platelets in circulation, and their numbers normally remain steady. Abundance of different types of white blood cells varies in response to the challenges by invading pathogens and other foreign antigens. Process by which the formed elements of blood develop hemopoiesis and before birth, hemopoiesis first occurs in yolk sac of an embryo and later in the liver, spleen, thymus, and lymph nodes of a fetus. Red bone marrow becomes the primary sites of the hemopoiesis in the last 3 months before birth and throughout life. Red bone marrow. Highly viscosized connective tissue located in the microscopic space between of spongy bone tissue, present chiefly in bones of the axial skeleton, pectoral and pelvic girdles, and proximal epiphysis. Under certain conditions, yellow bone marrow can be converted into red bone marrow, and repopulation of yellow bone marrow by pluripotent stem cells. Bone marrow examination. Sometimes sample of red bone marrow must be obtained in order to diagnose certain blood disorder such as leukemia and severe anemias. BME may involve bone marrow aspiration, withdrawal of a small amount of red bone marrow with a fine needle and spring, or a bone marrow biopsy, removal of a core of red bone marrow with a larger needle, usually taken from the iliac crest of the hip bone, sometimes from sternum. In young children, bone marrow sometimes are taken from vertebrae or tibia. Tissue or cell sample is then sent to the pathology lab for analysis. Lab technicians look for signs of neoplastic cells or other diseased cells to assist in diagnosis.